Hello everyone, and welcome to another video of We Teach. My name is Sara Al-Qabbani. I'm a Year 6 student intern. This is going to be a 3-minute video about the diagnosis of DKA and the diagnosis of HHS. Diabetic ketoacidosis and hyperglycemic hyperosmolar states are one of the most encountered conditions in the hospital. Therefore, it is important to differentiate between those two conditions, especially that both of them present in diabetics. Let's start with diabetic ketoacidosis. In order to remember the diagnosis of DKA, it's best to think about it as the 3 letters D, K, and A. D stands for diabetic, K stands for ketones, and A stands for acidosis. When we say diabetic, the criteria is to have a glucose more than 250 milligrams per deciliter. And when we say ketones, it's either to have ketonuria more than 2 plus or ketonemia more than 3 millimoles per liter. As for acidosis, it's to have bicarbonate less than 15 or pH less than 7.3. And this is the criteria to diagnose DKA. Remember that patients with DKA usually have a fruity breath, and the reason for this fruity breath is because of the ketones. Now we go into the hyperglycemic hyperosmolar states. In order to remember HHS, we can think about the diagnosis as a triad. The first item in the triad is to have a glucose more than 600 milligrams per deciliter. Please note the significant difference in the level of glucose, which is much higher in HHS. The second item is serum osmolality more than 320, and that also differentiates it from DKA. The third item is volume depletion. Patients in HHS have severe volume depletion, which also differentiates it from DKA. Please note that in HHS, you have no ketosis. Therefore, you will have no elevation of ketones. And that's a very important thing to differentiate between HHS and DKA. And with this, you can differentiate between the diagnosis of DKA versus HHS in a diabetic patient presenting in the hospital. This is the criteria in the simplest terms.